We do provide really, really good care, and people would just be astounded if we had the time released to actually do the things that we want to do. So my seeing this as a success would be that we would have that extra time at the bedside to spend with patients, to spend with families, and really make them feel a part of things and take ownership of their health. I think that the people who do the stocking and the nurses who go to get stock, if we did the WOW workplace, would just be in their glory going into a storeroom instead of wondering if something's going to be there or wondering how many should be there, things like that. I think that we would be able to give that extra special attention to people, and I think that they would really take notice of that and just be impressed by how things can change even though they thought it was so good before. And I think that the staff would actually look forward to work, that they would feel fulfilled, that they're doing their job, providing safe, competent care, and they could be really proud of what they've done by the end of the shift. And I think it would also help to increase with the interaction between different staff members. We do have a pretty good relationship and we do things together as an entire staff, but I see this as something that would definitely benefit all of us as well as attract new staff members. So my vision is to see all those things as successes and to see all my hopes met. And we know that's going to take time, but darn it, we're ready to try.
Everywhere you look, you can write a book on what's going on. Everyone you know's got to reap what they sow, be it right or wrong. Ghettos flood, there's a hole up in the sky. Oil and blood, tell me why, oh why? Terror struck, look at us, this isn't what we planned. You gotta take a stand, don't forget that.
Sometimes senior administration gets caught in the thick of big things. So it's like the CT scan or the strategic plan, the capital project overall at the Vic Hospital, big ticket items. And sometimes what is getting in the way of care are things that would be about this big, right? When you think about a doorway through, that should be the stuff that just moves quickly.
Every now and then you
This feeling on the floor of hope, restoring hope that this isn't just the same old, come to work, punch the clock, go back home. Yet there's no hope that tomorrow's going to be any better than yesterday. In fact, there's a pretty good chance it might be worse. And we want to flip that type of thinking around.
I think definitely the morale changes as soon as you start, because it's so frontline driven, and that's what makes it successful, and that's what builds the staff's morale as they realize that they have a say.
Forget that pride always goes before the fall. And nobody's free till there's freedom for all. As you sow, so shall you reap. Be the change that you want to see. Oh yeah. Be the change that you want to see. Yesterday, heard you say that there's nothing you can do. I wonder if you'd feel the same if it was happening to you. Don't forget that pride always goes before the fall. And nobody's free till there's freedom for all. As you sow, so shall you reap. Be the change that you want to see. Oh yeah. Change that you want to see right now. Be the change that you want to see. The changes start with you. Be the change that you want to see. The change that you want to see. Be the change that you want to see.